Hello, everyone. Welcome to our latest edition of AJOT Authors and Issues. Here on the Authors and Issues series, we like to talk to authors about their research and other things to help bridge the gap between research and practice. My name is Stacey Reynolds. I am the editor-in-chief of AJOT, and co-hosting with me is Ashley Gross, who is the AJOT student representative and also an OTD student at Virginia Commonwealth University. And our guests today are Bianca Daugherty from Colorado State University, Dr. Antoine Balliard from Duke University, and Dr. Quinn Tyminski from Washington University in St. Louis. And they are the authors of an article just published in AJOT entitled An Argument for Guidelines for Capstones in Unhoused Settings. So hi, everyone. Welcome. We're so glad to have you here today. And I was hoping we could start by just having you each tell us a little bit about yourself, where you're zooming in from, and maybe the history of how you all started working together to create this project or to write this article.
I can go first. So thank you for the introduction. I'm zooming in from Fort Collins in Colorado, where Colorado State is based. I'm originally from Ireland. That's where I trained as an OT and came to the States in 2016. I would say most of my work has been in mental health, and then for the past 5 or 6 years, focused on working with unhoused folks, particularly unhoused youth. I moved here from San Diego, where I had built an OT program for transition-aged youth, so 18 to 25-year-olds who are unhoused and struggling with mental health and substance use challenges. And then the history of us all working together, I think, is Quinn. She got us all together. So I don't know if Quinn, you want to take over?
Yeah, if you don't mind, Antoine, I can go next.
Right.
Quinn Tyminski, I am zooming in from St. Louis, Missouri, where Washington University in St. Louis is. I have been a community-based mental health practitioner since I started as an OT 12 years ago. And about 8 or 9 years ago, I transitioned to working with the unhoused population, actually originally through my post-professional OTD project, where we've started testing out OT services in a local shelter. And it's built from there. And, we have a student-run clinic in a local shelter, and we've done a lot of work around advocacy to get OTs hired all around St. Louis. But I think the history of how we came together is those of us who work in unhoused services know that there's not a lot of us OTs doing that. And so I think we sort of all organically tried to find each other. Bianca and I had met through the community of practice on homelessness. And then we actually had a chance to spend time with each other at a Society for the Study of Occupation conference in St. Louis. And then I think the next year, or maybe actually the same year, Anton and I also had a conversation. And I sort of had this moment of like, there's a group of us doing this work, and we would do it better collectively than we will do it solo. And Antoine helped me with that idea. So we sort of formed what we're calling our Unhoused Research Collective, a group of us. And not joining us today is Caitlin Sinovic and Lauren Little. And Lauren actually presented at that same Society for Study for Occupation conference. And I had known Caitlin for years because of her work in the unhoused population as well. So it was just a really kismet moment of all these people who really care about the same thing coming together.
That's right. That's exactly how it happened. So, hi, I'm Antoine Balliard. I'm in Durham, North Carolina. I'm at Duke University, and I remember it was at the Society for the Study of Occupation in St. Louis when we met, and we're like, we should do something together about this. And then Quinn took the lead from there, and then Bianca did as well. So, yeah, I've been working in mental health since I became an OT in 2006, and I pivoted to working with adults with serious mental illness who are homeless probably in 2017, and since 2018, so I guess 6 years now, I've been PI on a grant from SAMHSA, the Substance Abuse and Mental Health Services Administration, where we provide a sort of outreach to folks with serious mental illness who are homeless or at risk of homelessness. So it's a pleasure to be here, and thank you for the introduction.
Great. Well, I'm excited to get into this. This is a really unique but particularly relevant and timely topic for us, for your article and for us to be talking about. And for those listening, the paper kind of focuses on this idea of capstones and having students in these capstone settings. And it is a requirement for all entry-level occupational therapy doctoral students to do a capstone. And this consists of some type of learning experience that offers value to the student and the profession. That's how it's stated in the guidelines. And as you explained in the article, the unhoused population, they often have higher complexities with a lot of different things, with contextual factors and other things that should be considered if students are going to be working with this population. And to quote specifically out of the article, you say, in contrast to other occupational therapy settings, serving unhoused people is a practice area defined primarily by context. And I was wondering if you could expand on that just a little bit.
Yeah. It's a pity that Caitlin is not here because I feel like she coined that phrase, but I think it's just getting at that point that, in other kind of more traditional settings, as an OT, you're working with clients based on the exacerbation of maybe one condition or circumstance.
Mm-hmm.
And with unhoused folks, there's just a lot more happening kind of under the iceberg. There might, first of all, be multiple conditions or things that are happening that are exacerbated, plus the unique environmental challenges of living on the streets or in a shelter, plus the other kind of system-wide contextual factors that kind of need to be considered. And each client will have a unique constellation of all of those things. And so there's just a lot more going on when you meet someone who's unhoused than in another setting. I don't know if anyone else wants to expand.
Yeah, I think so. I think to expand on what you said, so other OTs may say like, oh, I work in a population of individuals on the autism spectrum, or I work in a population of individuals who are post-stroke. But this is not like there's not a specific common diagnosis, right, in our population. It's like the commonality is the context of homelessness. That's what binds all of the clients that we see together. And specifically when working in this, and Bianca hit on this so nicely. Most of what we're doing is within that specific context. So when we're thinking functionally, it's about like, what are the contexts of being unhoused? And so, very often there's not an opportunity to do your own laundry because it's done for you at the shelter, and your cooking options are Tupperware containers and microwaves, right? And so thinking about every intervention and assessment, I would say, from that specific context is then what makes it super unique.
Yeah, and I would also add, it's really at an intersection of like mental, physical, social, and cultural kind of issues all coming together in one place. So it's incredibly complicated in that way. And although I've been focusing on serious mental illness, there's not a single person that we work with that doesn't also have a chronic physical illness that then it makes it incredibly complicated within our context too. And then to make it even more complicated, we're working in three different areas here, and the other authors as well, the two additional ones. That looks entirely different as well because we have so many different resources and services that are available that are different within our respective context, that actually getting to know how to work with the unhoused population in my area is actually really different than what Quinn and Bianca have to deal with. And I'm not sure those skills would necessarily very easily transpose, right? Like I think we would need to like do a lot of learning if we shifted contexts. So yeah, I really do think it's unique in that way.
Yeah, partly because of the way that like each city functions, right, and like the resources that are available, but the funding
Absolutely.
and the governing body. Yeah.
Governing body, urban versus rural, et cetera, et cetera, et cetera. Yep.
And I wonder if that transfers to like program development too, that a program you develop specific for some place like Fort Collins isn't a program that's necessarily going to be effective for the population that's in Durham. I mean, do you find that there's a lot of modification that has to happen at that programmatic level?
Definitely. I mean, even for myself, like I moved from San Diego where I had been for, 5, 6 years developing a program, had developed all this familiarity with the context there. And now I'm in a city that's a lot smaller, operates very differently, has different kind of funding streams. And I'm currently trying to, in the middle of a program that I've developing with the public library for folks who are unhoused. And even that is very different, like understanding Fort Collins's unique structures and housing systems is very different to a city like San Diego. So I'm going through that right now. And so I feel like the translation, like Antoine said, to another context is difficult.
Well, thank you. That really provided such great insight into the high complexity of considerations that we need to take into consideration as practitioners. So one of your main reasons you state for guidelines being necessary when capstone students work with unhoused individuals is that there's actually a risk to cause harm. Can you talk more about how
We're back.
Hey.
Okay.
I don't know
Sorry,
what
guys.
happened there. Yeah.
Yeah, I just jumped out. That was so
Joys
weird.
of Zoom.
Okay. Why don't you repeat the question, Ashley, and we can just go in and crop that little blip out later.
Okay, sounds good. So one of the main reasons you state for guidelines being necessary when capstone students work with unhoused individuals is that it actually may cause unintentional harm. So can you talk more about how students and their capstones may unintentionally cause harm to this population?
Yeah, I think kind of the main point of the article is that the harm can come when the appropriate knowledge and skills and intentionality are not developed and put into designing the capstone experience. And if students don't spend time learning about the population themselves and the systems that they interact with, then they risk kind of coming across as having a savior complex and the experience becoming more about, the student feeling good about contributing to a social problem, rather than providing actual direct benefit to unhoused people or the agencies that support them.
Yeah, and I would like to add to that because I think one of my biggest concerns is very often like the harm, not yes to the individual, but also to the agency when we're talking about sustainability of a project. So, I think I don't want to step on your toes. This is a question later, but a lot of this whole topic came around for us because a lot of us are inundated with meetings with students who want to do capstones in this population, and they're doing so in spaces that don't have an OT because there aren't that many spaces that have an OT, which we're not necessarily saying is a bad thing, but what we're saying is then if that student goes in and does a 14-week capstone project in this organization, what are they leaving that organization with, and what kind of experience is that organization having with OT that may color their future experiences with OT or any other healthcare professional? And so it's sort of thinking about it, and I think it comes back to that a little bit of that savior complex that Bianca mentioned, like, are we actually meeting the needs of the agency and providing them something that is sustainable and long-term and beneficial for them, or are we going in to meet our own needs, which is just to do a capstone in something that I'm interested in?
Absolutely. And there are like a lot of potentially missed opportunities to do the right kind of care because of the lack of understanding of the complexity of what the person's encountering. And this group has had a lot of folks try to come work with them, and a lot of folks haven't followed through. And that's a major issue when you make a promise and you're not able to deliver it for this group, and that does a lot of harm, and it further alienates the person from services like Quinn mentioned there. And so the harm is pretty substantial and easy to do. So it's something we really need to be concerned about.
Yeah, I use the example a lot of like when I first started my program here in St. Louis, which has now been going for 8 or 9 years. One, they were hesitant to have us in the door because they'd had historically poor experiences, not with OT, but with like psychiatry, who had done med studies and left clients with worse symptoms than before. And I actually, the staff would say to me for the first 2 to 3 years that I would be there, they would say, "When are you leaving? When are you done? When are you?" And I would say, I'm not going anywhere. If WashU fires me, I'll probably still show up. Like, I'm here for the long haul. And they finally got to the point now that we've been doing this for 8 years that they believe me. But that's an example of that historical experiences that they've had that they're like, I don't see why this is needed.
Mm-hmm.
Yeah, trust and rapport is like so key to working with this population and the agencies that support them. And I think if don't follow through on your word or come across as a savior, like that will be disrupted and it'll be very difficult to repair it.
And then the person's less likely to seek services for another extended period of time. More harm is done.
Correct.
And I feel, as somebody who also works with capstone students, that can be really hard to get across, that they're hyper focused on this 14-week experience for themselves. And yet as the faculty member, you are very committed to these community partnerships that you have. Obviously, this is not my field, but other partnerships, and you're like, well, I'm going to be here for the next 20 years. And so what you do reflects on me, it reflects on our program, and it's really kind of shaping that lens for them, which kind of leads into the next question, because you do make in the article some really nice recommendations that students and mentors should follow when creating these types of capstones in particular. I think there's a lot of translation to other programs as well, so that potential harm can be reduced. And the first recommendation starts way before the capstone ever takes place, and that is reflecting on personal biases and privileges. So I was wondering if you could take a minute to one, talk about why that's important, but then what does that look like? What does that introspection look like if you are advising a student? How do you get them engaged in that?
I'll start because I think for me it starts even in like the planning of the capstone in being introspective of what do you want to do, and as we were just saying, like, you know, it's hard to get it across to students that maybe their plan isn't the best plan, and so being introspective of, is this something that I'm just wanting to do because I want to do it? Or did I actually speak to this organization and the people who are in it and the clients who are served by it and ensure that I'm meeting their need, that this is a real collaboration and not just something of my own? So I think it starts there. And then for me, it's also just this population, and many, like you said, this translates to many populations. We didn't want to speak beyond our specific knowledge, but obviously it does. This population is someone that has a lot of trauma, but that also experiences a lot of occupational participation that we would call like taboo or would fit under non-sanctioned occupations. And if that's not something that you're prepared to deal with and you're prepared to address it in a very harm reduction way, in a very strength-based way, then we're just going to further alienate that population. And that's not always what's like taught to us in OT school. That's not necessarily a framework that has come from OT. Like we've had to sort of adopt that from social work and other places. And so I think that is really important of like, how do I truly feel about substance use? And when I'm presented with it, what is going to be my response to that? Or sex work, or any of the things that we're going to talk about, and how is that my reaction to it and the way that I address it with that client then going to impact their relationship with healthcare in the future?
Definitely. I also think that the unhoused population in general, like outside of OT, already faces a societal bias. So I think students are kidding themselves if they assume that they have no bias, right? Like anything else. And so I think, and so folks are kind of othered and have this bias just for being unhoused. But then also there's these intersecting identities that folks in the homeless population often have, like Black folks and other people of color are unevenly represented in the unhoused population than the general population. Same is true for members of the LGBTQ plus community, the disability community, the mental health community. And so there's all these other systems of oppression that are also facing folks who are unhoused, as well as their housing status. And so I think because of as well as the occupations that they participate in, I think just based on who they are and their intersecting identities, there's also a risk of bias.
Yeah, I think it's unavoidable, right? I mean, there's enough research showing that healthcare professionals, even those who say they're not biased, are actually in the end biased, right? Because we just tend to sort of these social habits tend to inhabit us, right? So, yeah, it really needs to be looked at because of all those intersecting identities that tend to bring in a lot of assumptions, like Bianca and Quinn have been mentioning. So one of the ways we do it, it's not just like sitting down and thinking about it, but sometimes you need some structure. And I stumbled across this article that talks about a social identity map. That's just one example of how you do it. And basically, all it does is it makes the person sit down and fill out these different demographic characteristics that they have in relation to themselves, and then to reflect on the next level, like how does that change how you see the world, and then how does that make you assume things about others? And it's not perfect. There's no perfect way to do it, but it really just kind of guides the person to sit down and critically think about, here are these factors that I bring to this situation. This is how it makes me see this situation, and then to just have some awareness about that kind of sort of sociocultural baggage that they're bringing to that clinical situation, because it can be really negative, and a lot of folks don't realize how many assumptions they actually have until they sit down and take the time to think about it. Because all of us are really well intended. We don't want to do these things, but we do carry these things without realizing it, and it is important to structure that reflexive process.
I love that idea. And I also think that's great for like the long term, right? That's something that I mean, all of us have to regularly reflect on our biases in these works, and it's not we're not perfect at it. There's moments when like a client will say something and internally my brain will think one thing and I have to actively like reframe that for myself and think that's not the way that we're going to go about addressing this, Quinn. And so it's constant work.
Yeah, it takes practice and habit and insight to know that you do that. And if you don't have the practice with someone else to guide you through it, you're not going to develop that reflective habit. So it really needs a lot of practice, like you said.
And humility to recognize that we all have it.
Yes.
Yeah.
That's great.
So as occupational therapy practitioners, you mentioned that some of the frameworks that we are taught in school are just maybe not enough when we're looking at this specific population. So what are the other frameworks that y'all use, and why is it important to draw from them, such as critical race theory or intersectionality theory, when we're working with individuals who experience homelessness?
I think it goes back to the intersecting identities that the folks that we're working with have. And so in order to be truly client-centered in a setting like this, you need to look beyond the person and consider kind of the broader structural and social systems that are impacting how that client engages with the world. Just looking at their occupational performance abilities is not enough.
That's really helpful.
Yeah.
No, I was going to say, and I think, I know there's only so much we can teach in our curriculums, but I do think based on where these capstones are, they've really expanded where OT is. And it may also then expand the lens of theories that we need to be familiar with or think about in some way. And that, again, I think the onus comes to that faculty advisor to really think about what does the student need to think about and do in preparation for whatever that setting is.
Mm-hmm.
Yeah, I was going to say, I think exactly what you just said. We only, we can only teach so much. And I think historically, OTs have not always been great, and particularly new OTs, about going out and finding these other frameworks that are outside of OT and saying, like, we don't need to reinvent the wheel. This already exists in psychology, sociology, social work, right? And like, let's look at how do we put our OT lens on it? But it exists out there, and let's recognize the strengths of these other professions and how we can bring them into OT. So things like exactly what you were talking about.
Oh, sorry, Quinn. Were you
I
finished?
just want to say, Antoine, go ahead.
No, okay, yeah, no. I mean, I would really advocate for what you call epistemological pluralism, right? So the kind of the idea that you can have these different ways of looking at things, and you should be adopting different frameworks and theories for looking at the same wicked problem, because it'll give you a more holistic understanding of what that problem actually is. Whereas if you approach it from only one lens, you will, if you will continue with this metaphor, only see one slice of it, and you will have just much narrower understanding of what is going on, including what you can do to maybe potentially remedy the situation. So I highly encourage people to be very pluralistic in looking at different ways of structuring the reality, I guess, not to get too big and into too much ontology. But what's really important, though, is that folks really appreciate the fact that they need to be thinking about people very deeply embedded in many systems. And I think that's really critically here. It's sort of what we've been talking about this whole time, is that folks are not operating in isolation, and they are operating in these existing structures that are significantly affected what they can and can't do on a daily basis. And so I would encourage anybody getting in this space to dive into those kinds of frameworks that are really situating the person deeply in kind of intersectioning structures. Yeah.
Yeah, and I'll add that like the majority, like if you're an OT working in this area, you're probably the only OT for a while. And so being able to have these other frameworks also gives us commonality, like with these other people that we're working with. So we can have this discussion with the psychiatrists and the case managers and the social workers that we're seeing, and even the political like advocates, the people that we need to get to change the structures. It gives us that common language. And so if we just are only talking about OT frameworks, then we constantly have to explain ourselves. And that's another reason to sort of broaden that out.
I love that. And it kind of leads into the next question, which is, there aren't a lot of OTs working in these settings. And so that can also be an issue for students who want to be placed, are really committed to being in these settings. But what are the barriers for OT being employed with this population, being able to be an OT with this population? Obviously money is going to come into play, but what are all the issues? Like, lay them out for us.
I think probably bias. I mean, I think OTs have bias too, just like everyone else. So maybe there's not, as much interest in working with this population. I think money to fund these programs, but I found even when the money is there, like OTs don't necessarily want to work in it. Maybe they pay a little less than your job in a SNF or a hospital. So I think even when the money is there, maybe OTs don't want to work in this setting.
Yeah. So I think to echo that and around money. So I think the two things for me the 2 points that I have is, one, that the organizations just don't know that OT is something that they need and want. And so just a tremendous amount of advocacy at not our traditional levels, not our traditional spaces. So one thing that we've been doing in the St. Louis area is we're going to our Continuum of Care meeting, which is the Continuum of Care is the organization that sort of every organization who serves the unhoused has to be part of. And so we're going to those meetings and talking about what is OT and why do you need it and how does it help? And I'm getting service providers saying, like, this is the missing piece from our program. This is like why our clients aren't staying housed, or like why they're not prepared for those transitions. We didn't realize that there was something out there that did that. So I think that's piece one. And then, like I said, piece two is funding, because one, it's not clear how OT is funded even under like HUD. So when they're applying for big HUD grants, it's not necessarily clear like where OT fits into that service provision. And then most organizations either use grant funding or just sort of decide to take on the salary of an OT, which we know we're expensive. So one of the things that we've actually been working on in the St. Louis area is trying to put together, we're working on a company that essentially can do contract services out to different nonprofits to share the cost of an OT across nonprofits. Also, because that would just do an amazing continuum of care for our clients to be able to see the same OT or even the same like company of OTs to different, as they swap between shelters. And so just finding ways to cost share for these organizations is really powerful.
That's really great. I'll echo a lot of what Quinn just said right there. I mean, most places are not aware of what OT is, or if they are aware of OT, they are used to thinking about OT in inpatient, phys dis type setting, right? And they're like, what, mental health? What, folks with homelessness, unhoused? I'm sorry. And so it's really like a lot of advocacy, a lot of education, just to create the need, I guess, for people to be aware that there's that need. And yes, funding is an issue. But we have had some funding and have had a harder time finding the OTs to fill those positions. I think a lot of it is just because there's not a lot of structure around these positions. A lot of it is you're kind of a trailblazer. There's not a ton of research around it, and so it's hard to move in these new spaces and to shake things up. Whereas going into more traditional settings where everything is much more clear cut, it's a lot easier and a lot less stressful in that regard. So I think that the uncertainty behind the position is also a big barrier for some folks.
Very much so.
And I think the lack of, when you mentioned advocacy, also kind of limited data to reference. So I think every position, every program that's developed working with this population needs to have a data collection focus. I feel like I'm constantly trying to figure out what's the best way to capture our impact, right? To be able to advocate to higher ups about what we're doing. Because of OT, yes, this person was able to learn the skills to be able to grocery shop or cook a meal by themselves in their new home, or something, like trying to figure out the best way to capture what our impact is beyond, because I feel like a lot of these agencies, like their data and numbers are more just like, did they get housed? But I feel like we can add the piece on, but were they housed successfully or long term, or did they have the skills developed to live independently?
Yeah, I think we can't rely on the agencies to track that data. That has to be coming from us, because agencies generally don't have a good process for tracking data. And if we can actually provide outcomes and we can actually increase our funding year after year, then we can show benefits and we can go back to those funding sources and say, here's what OT has done. but we can't count on the agency to do that for us.
No.
Sounds like you guys have your work cut out for you, to be honest. It's like, I mean, it's hard enough to measure outcomes in traditional settings, and I think we're still trying to do that in really good, rigorous ways. And then, like you said, all of these complex dynamics. I think my brain went to statistics and how do you account for all the variation and all of the outcomes that you're going to have. And but yeah, it's amazing. I wanted to. You touched on this a little bit, but the idea of sustainability and the well-known limitation of capstones is that they're only 14 weeks long. And I know for us, I think the new standards say that the students have to do their field works first. And so for most programs, their capstones are all happening in the same semester. So it's hard to have a year-round capstone in any one setting. At least that's something we're dealing with. So how does sustainability happen? And whose responsibility is it to address that? You know, is it the faculty? Is it the students? Is it the sites? Or how do they all work together to make sure that something meaningful happens and that ideally the relationship can be sustained over time?
I think, like Quinn said, it needs to be addressed well before the capstone starts, like in the capstone kind of development process. And I would say the primary person driving that process should be the student. I think they should consult their site and they should consult the faculty mentor with expertise, but they need to take that time to do that intentional reflection on their biases. They need to consider, is this project really affecting change in this population or this agency, or is it just something I want to do? And how am I going to limit that? And how am I going to think about how this is going to be sustainable? So be thinking about deliverables before they even start. So I think it needs to be a really intentional planning process where that's addressed.
I agree, but I think the student needs some support there, right? So the student should drive it, but we can't expect the student to have that level of maturity to know to do that, right? So like they'll need some structure at the very beginning, I think, to do that. So I think it is a shared responsibility, but the student should definitely drive that exploration piece. Absolutely. Yeah. Oh gosh, I had another thought to say about that. Sorry, I lost it. Quinn, go ahead.
Okay, I'll go and then you pop in.
Yeah, I'll keep simmering.
And I think when I think more broadly, I think this is also part of what our capstone directors need to be doing. So we've sort of like always had this philosophy with capstones that like, you can be anything, you can do anything with them. And like, that's lovely in theory, but I think that there needs to be this recognition of like, your project needs to be sustainable. It needs to be something that, yes, you're going to learn something from it and like, let's make sure it's meeting your learning needs, but it also needs to actually serve the community that you're attempting to serve, not just serving them for 14 weeks. And so that kind of comes back to thinking about like what your deliverables are. And so I think that messaging needs to start from the first inception of Capstone, like when we start planning it. One of the main tenets of it needs to be sustainability from day one. And then it's not only the capstone director who's supporting that planning, but any other faculty are helping with that. And then, it's not all on the agency and the student. It's kind of brained.
Yep. Thanks, Quinn. I jogged my memory. Another like potential thing, and this is only if you're able to get a long-term grant project. But so in our situation, we did have 5 years of funding, and we were just re-upped for another 5 years, and it's been marvelous because we've been able to start like a lot of long-term projects, and then students are able to come in and out of those projects. So that sort of eliminates that problem from the beginning for us. Even though we're always an eye on sustainability for sure, we're because we have that luxury right there that if you can find a partner, and this is the only way we got this kind of grant funding. It wasn't me going out there as the PI. I'm a co-PI. There's two of us, but we partnered with so many folks, and we couldn't have done this on our own. Like the need to collaborate and partner is the key here. And once you get that going, then maybe you can involve the OT students. At least that's how we did it here in Durham and Chapel Hill.
Yeah, no, I think that's a super important point. Is I think we see the most harm when an OT student is saying like, I want to start a program in someplace new that doesn't have OTs, and that's where we see like sustainability issues versus students who come to do capstone stay with us, where we already have an established OT, we already have an established OT program, and so we have a lot more ability to say like, okay, we're going to help you build something that we're going to be able to continue.
Yep. And then maybe another student can help deepen that and sustain it as well. And yeah, so like that's at least that's the way it sounds like you're doing the same thing, Quinn. The way we're able to do it in a sustainable way. I'm sure there's other ways. We just need to think of it.
Yeah, I think at CSU, when the students start thinking about what they're going to do for their capstone, we have kind of, a few choose your own adventure folks, and we're guiding them through that. But I think we're trying to encourage the majority of students to pick from what we call like the capstone menu. And a lot of that has faculty ongoing projects on it that I think will contribute to that sustainability piece.
Capstone menu. I like that. I'm going to borrow that from you, Bianca.
Well, it seems like the idea of sustainability is really just like a culmination of everything we have just talked about, starting with understanding the high complexities of their context and then going into reflection of biases and privileges, talking to practitioners who are in the field and those who like are content experts who may not be OTs, looking at different frames of reference and from other disciplines to really get a full, like, holistic view. And so, as an OT student, and for other OT students, what would you say for those who are considering the unhoused setting for their capstones? Because I will be coming up on mine quite soon. So
Yay.
Don't let this scare you.
Is going to give her a lot of direction. Sorry, Antoine, go ahead. What do you have to say?
I was just saying, don't let us scare you from not doing it, because I feel like we painted a pretty somewhat negative picture due to the complexity of working in these spaces, but it's so important, and there's a lot that can be done. I think from a student's point of view, I would just say be sure you're partnering with folks who know what they're doing and who've been doing this for a while. And if you do that, then and maybe you read the article here and pay attention to some of these guidelines that we're suggesting, then you should be fine, and don't be scared of doing it. But to do so with caution, though, because it is a unique place and it is a setting where you could do harm, and none of us want to do that. And so just to do so carefully.
Yeah, I would echo that. I think it's, again, not something that we're saying don't do. I don't think any of us would have been here if we hadn't, had some sort of project to get us started. But the idea is that you have put all of the forethought in, and it's not something we just sort of decided to do on a whim, that there's really been intentionality around the entire planning and program design and implementation. And then I think the other piece that I would have is get some shadowing experience with this population before you decide to do your capstone in it. So, a lot of people think like, oh, I'm just going to go into it. You don't know what this might bring up for you. I've had students who have had, past experiences with individuals with serious mental illness that have left them with some traumas that didn't come up until they got into this population. And so it's really good that you've spent some time with this population beforehand, just so that you one can fully design something that is actually going to meet their needs, but two, so that you can kind of go back to that introspection, but think about how, what things are you going to have to put in place for you, not just judgment and bias, but also self-care when working with this population.
Yes, definitely. I had one student that I interviewed for a fieldwork tell me that I scared them by how much I emphasized self-care in the interview. I think that's so important. I think, to have supports in place, whether that's therapy or family or just self-care habits and routines that you build into your day, be intentional about that versus just having to set those up when you're halfway through the experience and something comes up for you. I think
that's probably good advice for capstone and fieldwork students.
Yes.
Broadly.
Yes, I agree. Be intentional about it, and have thought about what stuff might come up, and have worked through that kind of before you're in it, because it'll be too difficult while you're in it. I think, like other people said, read the article. I think talk to and potentially shadow as well. I think that's a good idea, to other OT faculty or practitioners or OT students who have done these kinds of experiences before and what they would recommend. And I think also kind of being prepared to, I think a lot of this work, whether it's thinking about frameworks or thinking about the standards or the competencies that you need to work in this setting, this is going to kind of go beyond maybe just kind of the baseline AJOT standards and kind of more typical experience for capstone. So be prepared to do that outside research. Be prepared to go beyond what's asked of you or what's presented to you. I think would be my advice.
That is very, very well put. Well, it's very clear that y'all are very passionate and knowledgeable in this area. And so I'm curious what your future plans are. Are you going to conduct more research in this area? Just where are your directions going?
Oh goodness, y'all.
Yeah, do you got another 2 hours?
Yeah, the abbreviated version,
Lots of
please.
ideas.
Jeez.
I mean, I don't know. I don't like, so I think personally we're all moving forward, but I think one of the reasons that we came together in our sort of our first product was this article, but we wanted to find a space where we could work together and find grants together, do multi-site studies together, and be able to actually like produce some science and some research around this population so that we can continue to prove our benefit and continue to get funding. So broadly, I think that's what I'm envisioning.
Yep.
I like the idea of the more collaborative effort moving forward. You mentioned that you have a COP that is that through one of these special interest sections. Can you talk a little bit more about that? Because maybe people who are interested in this topic could go to the COP meetings or look at the resources. Is there more info on that?
Yes, there is a community of practice for homelessness. I believe it is sponsored by the mental health special interest section.
Okay.
It generally meets on Wednesday evenings. I can't remember which one though. So it is a great place for students. We get a lot of students in it. And so I would recommend that if that's something you're interested in, it's a great place to network. And I would have to look up the further information.
It's on AOT's website. You can just register for the Zoom link, and it'll just continue to appear on your calendar.
Perfect. And we'll link to that as well below the video. So on authors and issues, I think you guys are first-time guests here. At the end of our very serious discussion, we like to play a little party game to get to know you all better as real people, because you are people beyond your research and your OT passions. So given that there are several of you on the call today, we're going to play a quick game of speed dating where I ask you get to know you speed dating questions, and you have to answer with the first thing that comes to your mind. So no elaboration. You have to just come right out with it. And we'll go in the order of my screen, which is Bianca, Quinn, and then Antoine. So you'll each answer each of the questions. Sorry, Bianca, you have to go first. All right. You guys good for playing this game?
Sure.
All right. First question, we'll start with Bianca. Other than occupational therapy, what topic are you most knowledgeable about?
Beyonce.
Quinn.
I'm going to say two, Taylor Swift, and also belonging research, because that's what my PhD dissertation is, and I'm in the middle of it right now.
Fair enough. And Antoine.
Soccer.
Soccer. All right, we'll talk soccer after the call then. All right, next question. What would you buy if I gave you $1,000 right now?
I just moved house, so I think probably some new furniture.
When?
Some piece of fashion, shoes, handbag, probably not for a full handbag, but it's clothing.
Yeah. Bianca, I'm gonna steal yours. I would buy furniture too. My kids just broke our recliner, so we need to buy a new one. I could use that 1,000.
See, and I thought you guys were going to say like concert tickets or football tickets or something like that. But all right, very practical. What is the craziest thing on your bucket list? Something you want to do that's just out there.
I want to go to Sundance Film Festival, volunteer at Sundance Film Festival. I like movies and.
Oh, that's a good one.
Right.
I really want to learn French.
Okay.
Well, that makes me happy. Yeah, does it have to be achievable? Because this is kind of a thing that I've always wanted as a kid. But I want to go to space. I know that sounds very cheap, like a childhood dream, but it's happening now commercially. So maybe one day.
Yeah, get that new thing on.
Yeah, I was going to say that doesn't sound as far-fetched as it might have 10 years ago.
That's right.
All right, and the last question for today is, if you were arrested with no explanation, what would your friends and family assume you had done?
Probably protested something. I'm kind of stubborn and don't like to be told what to do.
Yeah, I think that was going to be my answer too. Like, probably something involving standing up for one of my clients down at the shelter.
Maybe going somewhere where I shouldn't have been.
We'll leave it at that.
Leave it at that.
Leave it at that. All right. Thank you guys for playing our game. I feel like I know you all just a little bit better, and you're very real people. So, before we wrap up, is there anything else that you would like to share with the listeners about the work that you're doing, or any resources that you would recommend to them if they wanted to learn more about this topic? We cover it all.
I think the community of practice is a good resource, and I think we reference it in the article, the Bridging the Transition framework developed by Carrie Ann Marshall and her team in Canada. Those are two good.
Absolutely, I'd echo that.
Yeah, I don't think I have anything additional to add.
Great. Well, thank you all so much for being here with us today. We appreciate your time. We appreciate your insight, and obviously the important work that you all are doing. And just a reminder that your article is published in AJOT. It'll be published, it'll be available full text and open access so that everybody can benefit from reading it. And we look forward to hearing more about the work that you're doing in the future. Thanks,
Thank you.
everyone.
Thank
Thank
you
you.
so much.
Thanks.